Good afternoon and welcome to the Capitol Report. I'm Nick Halter and I'm joined today by Representative Sheldon Johnson. Representative Johnson represents the east side of St. Paul. And let's start out, Representative Johnson, by talking a little bit about how things got kicked off this legislative session that began just a few weeks ago.
Yeah, well, it's great to be here and be back at the Capitol. This is the second year of the biennium, as if folks follow it might know or might not know. And what we do this the second year of the biennium is a couple of things. One is the bonding bill. That's huge. We want to take care of that. And the other is we have a budget deficit of somewhere in the neighborhood of $1.2 billion. And we want to make sure before we get done the middle of May that matter is taken care of and we have a balanced budget. But the big deal right now that we're working on is GAMC. And you know what that stands for?
Yes, GAMC stands for General Assistance Medical Care, and it does serve basically the poorest and sickest of Minnesota. It's about 38,000 people a month, and they quite a few of them have mental health issues and or chronic medical conditions, as well as a lot of them are veterans.
That's right. Last week, the House voted to restore benefits to the folks that are on GAMC, and that was a huge deal because the governor had taken care of that issue. He had vetoed it earlier on, and now we're looking at addressing the issue again this coming week, and I think it's going to be a big issue.
Yeah, and now the legislation to save GMC was, again, it was voted on by both the House and Senate, and both of them did pass by very large margins. Do you have any idea of what might happen in the coming weeks?
Well, that's what I think is going to happen. The Senate just today overrode the governor's veto, and we're going to hear the matter this coming Monday to see if we can do the same. And since the governor had line itemed it last year and also through the unallotment process later on in December even reduced health care by more, we felt here in the House, and the Democrats in particular, that we had to address the issue because, as you said, the people that are being hurt are the people that are most sick, the people that are earning on average less than $3,000 a year. These are people that 80% of them have serious mental health or chemical dependency issues. I think I saw that 60% have ongoing medical conditions that are very severe and significant. And as you noted, as many as I think 8,000 of them are veterans. And this is something I think that we really need to address from a couple levels. One, from a moral perspective, that we as Minnesotans, I think it's one of our values to show compassion to people who have less than us, and that we have a responsibility as a state to take care of this. And also from a financial perspective, it really is less costly to take care of folks early on in the preventative care and an ongoing attention to their medical needs and waiting till they have to go to the hospital and be seen in the emergency ward. So that's my thinking on it, that we have a moral obligation and we also have a financial obligation to the state to take care of this very serious problem of general assistance medical care. And
you were speaking of the financial situation that comes along with GAMC, and now I've done some reading on it, and it looks as though under the plan proposed in the legislature that hospitals would also be faring a lot better under that plan.
That's right.
I believe it's $87 million or so is the difference between the governor's plan. And can you explain how that works a little bit with uncompensated care?
Well, when one of these folks from GAMC go to the hospital, in our situation here in St. Paul, let's say Regents Hospital, they'd be provided emergency service, but the hospital wouldn't be compensated, so we call that uncompensated care. When I spoke with the folks from Regents Hospital just this week, they are thinking it's going to cost somewhere in the area of $60 million just to deal with uncompensated care a year if we get rid of GAMC. That's going to affect people's health insurance premiums. It's going to affect property tax increases, that sort of thing, if we don't deal with it now.
Okay. And we just have a little bit of time left here, but as far as what's coming up in the coming weeks, can you talk a little bit about the $1.2 billion budget deficit and what that's going to mean for lawmakers, what we might be seeing?
Well, we're going to be looking at different options to deal with it. The governor has made clear that he's not going to take any new revenue options, so that is more or less off the table. So we're going to be looking at the different agencies, whether it's healthcare or schools or the different departments in the state, to look at where we can cut waste or cut areas that result in a savings to the state of Minnesota. The governor also hopes to get money from the federal government, which I don't think we can really count on at this point, as much as $400 million to fill the hole. I'm not sure that is necessarily the case. So we're really going to be putting our heads together as legislators over the next few weeks to figure out how we can reduce this budget deficit and end with a balanced budget before we leave.
Yeah. Well, Representative Johnson, we appreciate you being with us here today, and we probably expect to be talking about these issues in the coming weeks as well. Thanks for joining us.
Great to be here.